All right, so I'm going to get my screen share up here and I'll get the slides for y'all while I'm doing that. My name is Rachel Mitchell. I am a clinical pharmacist here at W Medicine Specialty Pharmacy. Can you guys see the screen okay?
Yes.
All right. So what I'm going to talk today about, this is basically an approval and affordability talk, just to go over the insurance requirements for a couple of our local areas, our local insurers in our area, and then talk about how we get things paid for. So that's going to be my goal. I am going to mostly talk about West Virginia Medicaid. And what I always say is that if you can meet criteria for West Virginia Medicaid, you're golden for every other insurance. Medicaids in general, not just West Virginia, but Medicaids in general tend to be the most strict in terms of criteria and making sure folks have all they need to demonstrate medical necessity. So that's what we're going to do today. So for West Virginia Medicaid, y'all are probably aware that their prescription drug benefit is administered through the Rational Drug Therapy Program, or RDTP. So I have a link here to their criteria. I don't know if I click on this, if it'll pop up for you guys. I'll drag it over here because it came up on the other screen. Is this pretty familiar with folks? Have you guys seen this before? Okay, so you probably are pretty familiar with it. So that link that I have in the slides here should take you to this. And this is everything that you need in a one-stop shop for hepatitis C for your patients that have West Virginia Medicaid. So it has the criteria for approval as well as the different preferred regimens that are listed down here, their criteria for ribavirin, as well as some of their stuff for kids, for our pediatric patients. In addition, all of the forms and things that I'm going to talk about today are all hyperlinked on the top of this. So anything that you need, if you go to this link, it is your one-stop shop for getting your West Virginia Medicaid hepatitis C medication approvals. I also have their phone number listed here. If you needed to get a hold of them, follow up on it, or have questions, that's their phone number. And the preferred regimens for West Virginia Medicaid are the authorized generic of Epclusa, so your sofosbuvir, velpatasvir, and then Mavorite. So those are going to be their preferred agents unless you're proving medical necessity to use something else like Harvoni or Zepotir or something to that effect. So in terms of Medicaid, I also wanted to highlight some of their different criteria. So this is a snippet of what I showed you on that first site that shows for your treatment naive patients, for your adult patients, these are your regimens. I've had some folks say this kind of reminds them of like a Chinese food menu where you go through and check all the things that you want. So you go through here and see, what does my patient meet in terms of criteria? Is it adult? Have they been treated before? Do they have cirrhosis? Do they have HIV? So you can go through here and see which box is applicable to you, and it'll show you the preferred regimen as far as West Virginia Medicaid is concerned. All right. So as far as the important criteria that I want to highlight, first is your hepatitis A and hepatitis B immunity or vaccination. So when you're submitting, West Virginia Medicaid wants to be able to see that your patient has protection from other hepatitis infections. So whether they were previously infected or they had vaccination, that's what they want you to demonstrate. So you can submit vaccination records if your patient has those, or if you have them in your EHR, or if you don't have that information or the patient's not sure, you can draw their titers and be able to see it. So for other reasons, we look at hepatitis B, right? We want to make sure they're not at risk for reactivation. So you can kill two birds with one stone and do those titers at that point as well. So they want to see this submitted with the prior authorization form and with all the other things we're going to talk about today as well. I also really want to stress and highlight that West Virginia Medicaid does not require patients to complete the full series. So you don't have to wait for all three of the hepatitis B vaccines to be administered before submitting. They want to see, though, that it does continue. So kind of as an example to explain that, you don't have to wait that whole time. If your patient comes in, you do their titers, they're negative, they do need to be vaccinated, then you do that initial immunization. If you submit the application or the prior authorization at that point, West Virginia Medicaid will consider that as part of that vaccination process and be okay with that piece. Now, if you do that at the first visit and then want the patient to get blood work or something else, and then you're going to start at the next visit and it's been 4 months, but they never got the second shot in that series. If you submit it without that evidence, West Virginia Medicaid will say, hey, you started the series, but it's not continuing. Please continue on with the series before we'll do approval. And they'll want you to show proof that the patient is continuing on with the series at that time because they want to make sure the patient has that protection against hepatitis B. So the stress here is that it can be vaccination records or titers but also keep that in mind. If your patient does need vaccinated and there is a gap in that vaccination series, they'll want to see that you're continuing that, and they're going to get that immunity from vaccination. The other is the relative closeness in when they got their or most recent lab work. So the primary ones that they usually give us pushback on when they want recent blood work is the viral load as well as their fibrosis score. And their criteria is within the last 6 months. So they're pretty on, want that pretty much within 6 months. So if you're at 7 months, they will kick that back to you and say, hey, they need to have those labs repeated. So want to make sure that that is recent to their visit within that last 6 months when you're submitting that with that prior auth form. And the other stuff here that I've got, it's down here on the bottom is a snippet of the verbiage from the criteria and whether or not it needs to be within consultation with a specialist. So that's what we're doing here in terms of ECHO so that you can meet that criteria. And they've got it spelled out right in here that Project ECHO and West Virginia HAMP and those different programs meet that criteria in that consultation. Now, if your patient is very straightforward, as they have on I have on the slide here from that, where they're an adult, they've never been treated before, they don't have cirrhosis or co-infections with Hep B or HIV, not a pregnant patient, then they meet that simplified treatment guideline and you don't necessarily need that consultation in order to get that approval. But they do still highly recommend having the consultations for that prior authorization process. So again, this is just a snippet from West Virginia Medicaid. Other important things that I like to highlight are this patient-provider agreement form that you and the patient both have to sign. So what this is that the patient attests that they have been educated on the importance of abstaining from illegal drugs and alcohol, abstaining from getting pregnant if they're female, using barrier methods if they're male, and that they agree, the bolded part at the bottom, most importantly, is that they are to notify you prior to stopping treatment for any reason. So signing this agreement, they say they attest to either being educated or understanding all of these things on this checkbox. What I have highlighted at the bottom is what you're attesting to on this agreement form, and that's that you have to submit their SVR12 data to West Virginia Medicaid so that they can document whether or not the patient was cured. Not submitting this to them does put the patient at risk for retreatment later on should they need retreated for whatever reason, whether that's a new infection or because of a treatment failure. So this has to be filled out, signed by both you as the prescriber as well as the patient, and then submitted with that prior auth information, all your clinical data and the form as well. And then this is that SVR12 letter that they will send you when it is time. So this automatically comes from West Virginia Medicaid. They send it in triplicate via fax, and this is what it looks like. So everything on this screen that is in red is where they will fill it out with you and your patient's specific information. So this comes to you. They time it perfectly based on the regimen's duration of treatment, and then they add that 3 months. So it comes to you when those patients are due for their SVR to be drawn. So if they don't have an appointment, it can also serve as a reminder, hey, that patient needs to come back in and have their blood work done so that we can see whether or not they were cured. So they will send this to you, like I said, in triplicate, and they want this form filled out and then a copy of the lab work for their RNA submitted back to them so that they can document whether or not the patient was cured or if they would be a treatment failure. I'm flying through this. Any questions about Medicaid before I change to PEIA? Okay. Well, the easy thing about PEIA, or our Public Employee Insurance Agency, is that they very much tend to closely follow what West Virginia Medicaid does and kind of mimic that. So a little bit different though, their prior auth is administered through Express Scripts or ESI. So you can submit these electronically through Cover My Meds. I also have their phone number here if you would need to follow up or have questions for them. But with PEIA, you're submitting essentially all the same things. They no longer require the patient provider agreement. They used to, but that's not part of the criteria. But all the rest of the stuff in terms of blood work, hepatitis B, immunization or vaccination, having the blood work done within 6 months, those things are all pretty true in terms of PEIA requirements. So again, I'll say it again, if you have everything you need for West Virginia Medicaid, you're all set in terms of other insurances. So with the PEIA formulary, though, a little bit different. Their preferred regimens are brand Epclusa, brand Harvoni, and Zepitir. So those are going to be your treatment options for your PEIA patients. So a couple of things that I want to highlight as we dovetail into the prior auth's approved, but now let's talk about how we can make it affordable for the patient so that they can afford to take the treatment. So for West Virginia Medicaid, they can fill at any willing pharmacy. So any pharmacy that you like or the patient likes, does not have to be a specialty pharmacy. They can fill it so long as that pharmacy is willing to purchase the direct acting antiviral. And West Virginia Medicaid caps their copays at $3. So your patient's copay is anywhere from $0 to $3. Unfortunately, you cannot use copay cards through the manufacturer or any other government funded insurance. So the good news with that $0 to $3 copay is that it's not very much, and technically, legally, West Virginia Medicaid patients can waive those copays. Now, with PEIA, they do require the patients fill through a Credo specialty pharmacy. That's the contracted pharmacy for Express Scripts. However, I will say that if you have a pharmacy that you like working with, it's always worth checking to see whether or not they have a contract with PEIA to be able to dispense for those covered lives, because there are several pharmacies in West Virginia that do have those contracts. Here at WVU Medicine, we have one of those contracts, so we can dispense for PEIA patients. But when you do that prior auth and it comes back to you as approved, it's always going to say the patient has to fill with a Credo. So if you already have a pharmacy you like to work with and you know they have a contract, then they should be able to dispense it and get a paid claim for those patients. The difference, though, with PEIA also is their copays vary so much depending on the employer and the plan that the patient has selected. So I've had patients for PEIA have copays into several $1,000s. Maybe it's because they haven't met a deductible or the plan that they have paid, but that is not affordable for most people on the planet. So for their copays, even though PEIA is your state employees, a lot of times, right? There are teachers, universities, state road workers, all of them are state employees, but PEIA is a commercial insurance. It is not a government funded insurance. So those patients are absolutely eligible for copay cards through the manufacturer. And I always like to highlight that because some people think that they're not and that they're responsible for that copay. So we can get some financial assistance for those folks as well with PEIA. So I wanted to take a second here also just to go over the different types of financial assistance that we have available and what can and can't be used depending on your patient's insurance. So we have foundation assistance. So these are the types of funding that we can utilize for your patients that have government funded insurance, because they are not specific to any one manufacturer. So those can be used for your Medicare patients that maybe they don't quite qualify for the smoothing, or they can't even afford that smoothing with their copays. So those are your options for your Medicare patients to be able to bring those high copays down. Unfortunately, in the recent years, they are intermittently closed due to lack of funds. So what I recommend with the examples that I have here, so we've got Patient Access Network or PAN Foundation, as well as HealthWell Foundation. Both of these organizations are foundations for a lot of different disease states. So when you go to their websites, you can specifically go and search for hepatitis C funds, and you can sign up for alerts when they're open. So that's one of the things that I do here in the pharmacy. I'm signed up for those alerts. As soon as I get those, I go run into our insurance specialist and say, hey, do we have anybody waiting on financial assistance? It looks like PAN Foundation is currently open for hepatitis C. Let's grab some of that money for them. So you can go there and fill out that information for the patient. It does ask about their income, the number of people in their household, and that sort of thing to make sure they qualify. But I can't remember the last time that someone, when there was funding available, was denied PAN Foundation assistance for those Medicare patients. So if you take anything away from the foundation talk, go to those websites, sign up for those alerts, and you should be able to get those patients signed up for those. So those are two options for your Medicare patients. It can be used for commercial insurance, but the commercial patients qualify for things like copay cards on the manufacturer side, the green side of this slide. So those patients that have high deductibles or high copays, that's when we usually utilize those copay cards through the manufacturers. You can usually sign up online. Sometimes the patient has to call and confirm some information, but those can be signed up for pretty quickly and then bring their copay down to no more than $5. So those are options for your commercial payers for those patients. So you cannot use copay cards for anything government funded, Medicare, Medicaid, TRICARE, those sort of things. If your patient has no insurance at all, your option there is going to be another manufacturer supported program through their patient assistant programs or PAP programs. So that's what I have on the next couple of slides here. So I've got the support path enrollment form. So this is the Gilead manufacturer patient assistance program. So that's going to be your Epclusa and your Harvoni. I have the link to the support path site here, as well as a phone number, and then the snippet here of what that form looks like. So you can enroll online electronically with these patients, but also they have the forms like this picture here that you can print out as well, download that and print it out and fill it out with the patient. So it's a little bit more comprehensive. They will do an insurance verification just to see, one, does the patient have insurance that maybe they're not aware of or we don't know about? They always check that. And then they'll also check their eligibility for things like Medicare and Medicaid. So they review these on a case-by-case basis. They do require tax information, household income, number of people in household information to see whether or not the patient meets criteria and qualifies. I think so this is for Epclusa. I have the one here for Mavyret as well through AbbVie Assist. So for these, I always recommend trying these out if your patient doesn't have insurance. They're pretty good on a case-by-case basis to evaluate patients, even with pretty decent incomes, and getting those approved if they truly don't have insurance and don't qualify for any insurance. So with these options, they'll review the patient's income information, see whether they qualify. And if they do qualify for free drug, it'll come directly from that manufacturer. So with Mavyret here on the screen, AbbVie would send it directly from their pharmacy. Usually what we see is that they send the entire treatment duration. So if your patient's going to get 8 weeks, they send them all 8 weeks all at once. For Epclusa, they'll send all 12 weeks all at once. So always worth evaluating. I think they're both pretty equal in terms of their income requirements and where they are on the poverty line in order to qualify. But I think it's always worth it to go and say, okay, patient, so long as they qualify for both agents, they don't get approved for Epclusa, try Mavyret, see if that'll get approved. So I've got that contact information here with their phone number and then the link here to AbbVie Assist as well. And I think that's all I got here. So if you guys have any questions, anything I can try to answer for you, weird insurance information that's happened to you,